Hi everyone. So today I want to talk about the most common question I get asked every day in the office. And that is the question of vaginal discharge. Yes, you heard it right, vaginal discharge. So that's the number one most common question among women of all ages, whether it be young women or menopausal or postmenopausal women. And so actually what I want to tell you is vaginal discharge is relatively simple to understand. So I want to sort of demystify what people think about vaginal discharge. So I think immediately when people think of vaginal discharge, they think STDs or sexually transmitted disease. And that is important to think about, especially if you're sexually active. You do want to think about maybe doing some STD testing if you've been sexually active recently, or you've had a new partner, or you have kind of a lingering discharge that doesn't fit into the other categories I'm going to tell you about. So I do think STD testing is important. But a lot of vaginal discharge is just benign discharge. And what do I mean by that? I mean that the pH of the vagina is a relatively stable pH. So if anything throws off the pH, you can get discharge. So that means you can get sometimes an odor that's like a fishy odor, and that's the most common type of discharge called bacterial vaginosis. You can also get another relatively common vaginal discharge that is itchy and irritated and has a cottage cheese-like substance that kind of comes out of the vagina. And that is most likely a yeast infection. Those two infections, bacterial vaginosis and yeast, are very, very common. In some women, they happen very frequently, and they're actually very easily treatable. So I think a lot of women get really anxious about BV and yeast, and actually the treatments for them are relatively straightforward, and you can get a lot of the medication even over the counter. So let's say you have a yeast infection and you have this really itchy, irritated vagina, sex is painful, maybe you even notice a little bit of spotting. Well, if you have the irritation and the itching and some of that discharge, or you have two of the three, I would go ahead to the pharmacy and grab a Monistat. A Monistat is an over-the-counter treatment. It's been around forever. It's a treatment called fluconazole, and it treats yeast. And the nice thing about it is you don't need a prescription. You can go to any pharmacy and get it. You can get it any time of the day or night in a pharmacy that's 24 hours. So it's pretty accessible. So if you have those symptoms, you can go out and grab some medication for yeast and see if it improves your symptoms. Of course, if it doesn't, you should go immediately to see your OBGYN. But I think it's a really good thing to try if you have most of the symptoms. The other thing is BV, bacterial vaginosis. Now that doesn't have a good over-the-counter treatment, but if you have that fishy odor, then most likely it is BV. And you can call your local OBGYN and just say, I think I have BV, can I try the treatment, which is a gel that you place vaginally, and you could try it and see if the odor goes away. If you can't get to your doctor, BV is what we call self-limited, so it should go away on its own. It's going to give you that really annoying symptom of fishy odor, but it will ultimately go away, and it doesn't actually have to be treated. If it's neither of those two things and it doesn't fall into those two categories, and or you've had unprotected sex or even just sex with your current partner and you're worried, you definitely should get STD testing, because that of course will cover gonorrhea and chlamydia, which is a fairly common cause of vaginal discharge, which if you don't treat can lead down the road to pelvic pain and even infertility. So that does need to be treated. But if you have probably a yeast infection or BV, you can try either the over-the-counter treatment or let your OBGYN know, and sometimes they will just send in a Metrogel so you can give that a try and see if it helps your symptoms.